Hello, everybody. This program we will talk about the health of social relations. There are many social related health disorders, and the problems are different according to the society and the living environment of the society. We can divide this into physical health disorder, psychological health disorder, economical problem, man-made and natural environmental problem, administrative and political defects, interactive defects, and conflict, educational skill problems, etc. It starts to create a healthy relationship community. It starts with maintaining the health of personal and family relationships. A healthy family creates a healthy society. Many healthy society creates a developed and prosperous healthy nation. So, if we come to protect healthy family relationships, let me we talk as follow into the program. Stay together. What is marriage? Marriage is a social conjunction union of the man and the woman. Those two people, first for each other and then for the children they we have, are responsible for the living together. There is a need for the physical and economical performance when entering into the marriage. But this, I mean, the age, think, psychological, educational preparation are the basic standard to require for the marriage responsibility. Next, we will see in detail the negative process that prevent a healthy marital relationship and their solutions. The most common reason for divorce are commitment, infidelity, conflict, argument, economical problem, sexual health problem, misunderstanding, a lack of clarity in life and communication, a lack of house facilities, life skill and communication related reason, a lack of love, a lack of respect for partner of the family, and fulfillment of the family marital needs, just like jewelry ornament, physical and mental illness, physical abuse and insults, social and cultural lifestyle process. We can put this and other negative interactions as a reason. The most common final case are infidelity, domestic violence and abuse of substance. Instead of the blaming themselves for the divorce, many people are blame their partners. Recommendations for the couple to improve marital education in order to remedy the problem, including receiving a relationship education, getting support to apply skill outside of the curriculum, and adding contact about the typical standards, material life skills and development. Thus, results provide with sites to into the timing and the content of the premarital and relationship education. Divorced individuals have the higher rates of psychological distress, substance abuse and depression, and lower level of overall health compared to their married counterparts. Marital conflict and divorce are also known to be associated with the negative family and child psychological outcomes, including lower education outcome, poor psychological well-being, and more. Because depression and anxiety are the negative outcome of the marital conflict and divorce. The biggest goal of the premarital relationship education is to equip couple with the skill to have a healthy marriage. The family is the oldest social institution that plays an important role in the marital health of the community. Failure to construct social role due to one or more family members failing or failing to fulfill their roles can be defined as family disintegration or failure. Psychological belief that the health of the family can be achieved by creating a strong and lasting bond between a woman and a man. Therefore, the phenomenon of the divorce is among the most serious problems in every society. Divorce begins with traumatic experience between the spouse and ends with the resolution of the separation conflict and entering into a new position, a new role and lifestyle. They often have difficulty with each other, dependence, conflict and emotional pain for the longer period of time than the other. In most cases, women suffer more from the devastating effect of divorce than men. The various statistical data indicate the rate of divorce increasing in a different country. In our country, the lawsuit and dispute are held in many courts of the country. Although I can get the statistical data, we can all understand that there are many of us nearby. The number of a factor can affect an individual mental health. The numerous studies indicate that many health problems and mental illness have the social basis. Divorce can have the same impact public health as it does on family life. It causes social and economical and moral damage. Unfortunately, mental health problems have become one of the most important social problems due to the increase in the divorce rates. In this program, we will see in depth to solve the conflict and disagreements that a case of reproductive health disorders and psychological effect among the many factors that increase the life of the healthy marriage. What is reproductive health? Good reproductive health is a freedom from the risk of sexual transmitted disease and the healthy reproductive process. It must include the right to create and control own fertility with fulfilled knowledge of reproductive experience and skill choice, and the ability to control sexual regardless of their marital status, income or similar factor. The study shows that having knowledge about sexual and reproductive health improves the person's ability to have sex and give birth. They are often understand due to gender role and the lack of access to specialized healthcare and information resources. The lack of knowledge about their own reproductive psychology and psychological problems expose couples to conflict. We will discuss the case and treatment of sexual reproductive health problem in order. Sexual importance or the lack of desire, premature ejaculation, retrograde ejaculation, erectile dysfunction, infertility, importance, night dreams or spanados, excessive desire for the sex, orgasm and masturbation or self-sex, dissatisfaction, pain in the reproductive organ, just like ulcer, itch of the genital area, burning or pain during the urination, bleeding with the urine after the sexual intercourse, etc. We can mention them as the main sexual reproductive problems. Also, in our societies, they say they prefer medical treatment for such ailments. Some rural urban dwellers prefer private practitioner, traditional healers and home remedies. For example, eating a nut, mixed herb in drink like milk or butter establishes reason for alternative treatment seeking. Behavior include poor knowledge, privacy concern and the caring attitude for the doctor and the lack of specialists. A husband's sexual ability critical to the development of the marital relationship. Religious leaders and family physicians often act as a mediator of husband-wife conflict management. Counseling on sexual health issues is recommended. Husbands should be encouraged to seek treatment and share their sexual challenge with their partners, and they will discuss openly about it. I will project the medical offers and religious leaders can also be trained in family conflict management. Male sexual function is very important for the marital relationship. Having a healthy sexual relationship can lead to successful life together, or unhealthy sexual relationship can lead to the breakdown of the relationship. To address this problem, reproductive health treatment has the potential to reduce or prevent the effects of the marital breakdown and social dysfunction, thereby reducing the marital conflict. What is sexual dysfunction and how common it? Sexual dysfunction is the result of the person's unhealthy sexual desire, the lack of the desire, inability to arouse, and or the lack of sexual satisfaction, failure to each organism. Sexual dysfunction is common. Based on statistical data evidence, this phenomenon affects up to 30% of men and 40% of the women affected. Infertility is also the common problem for the married couples. Couples who have never experienced the major sexual problem are often in emotional distress and psychological distress. Due to infertility and other psychological health problems due to the lack of specialists and treatments, their sexual desire and satisfaction is low and they are in hidden pain. In order to overcome the sexual health problem, we will talk about the health problem caused by sexual organ, emotional, psychological, and physical health problem in detail in our next program. I wish you to have a good family life. I wish you love, peace, and health. Until they will contact in another program, I wish you have a good time. The producer and presenter Salam Alaikum Dosen. Have a good time. Bye bye. See ya.